Hi, I'm Todd Duncan, the chairperson for the Homeless Youth Subcommittee. I'm sorry I can't be with you today, but I'd like to share with you some highlights from our 2009 survey of Springfield's high-risk and homeless youth. The Homeless Youth Subcommittee was established nearly 10 years ago in direct response to increasing numbers of runaway, homeless, and disconnected youths observed on Springfield streets. The subcommittee identified a frightening gap in services for young people and partnered with them to develop services to fill the gap, which resulted in the opening of the Rare Breed Youth Outreach Center in June of 2000. The goal of the 2009 survey was to understand the backgrounds, characteristics, and needs of our high-risk and homeless youth in order to better inform our prevention and intervention efforts in the community. The subcommittee surveyed over 450 youths during a 5-week period in spring of 2009. The ages of the respondents were 11 to 22, and surveys were distributed to youth in 20 different locations throughout Springfield, likely to encounter high-risk and homeless youth. The average age of survey respondents was 17.1 years old. In terms of race, youth of color were overrepresented in the survey sample, making up nearly 1 out of every 4 survey respondents. With regard to sexual orientation, nearly 1 in 5 youth identified themselves as a member of a sexual minority group, being lesbian, gay, bisexual, transgender, or questioning. This compares to rates of 4 to 10% of youths in the general population that identify as a member of a sexual minority group. When looking at education, 29% of respondents dropped out of school. That's 5 times higher than the average dropout rate for Springfield Public Schools. Dropouts were more likely than non-dropouts to have been homeless, and we know that housing instability is linked to educational failure. Only 8.6% of the youth surveyed had full-time employment, and just half of these were making a full-time living wage of $7.50 per hour or more. The survey also found that 13% of youths indicated they or their significant other were pregnant, and of these youths, 22 already had 1 child. There were 70 youth parents that had 103 children, and 19 of them had 2 or more children. When figuring the teen pregnancy rate of respondents, it was 2.3 times higher than the teen pregnancy rate for Missouri in 2005. Homeless was defined for survey respondents using the McKinney-Vento Homeless Assistance Act definition of homeless children and youths, which includes sleeping in temporary housing like staying with friends, in a shelter, in a hotel, or sleeping in a place not meant to be slept in, such as a shed, car, vacant building, or not having a fixed adequate nighttime residence. 42% of the youth surveyed have been homeless before. That equates to 186 youth. When looking at Rare Breed surveyed respondents, 2/3 of them have experienced homelessness before, compared to 1/4 of non-Rare Breed respondents. We then asked youth if they'd been homeless with their family. 21% have, equating to 86 youth. 2/3 of them were homeless with their family for less than 1 year, and 1/3 of them were homeless with their families for 1 or more years. It is interesting to note that among our sample of high-risk and homeless youth, 56% of the youth that were homeless with their family were also homeless alone. Research shows youths aged 12 to 17 are at higher risk for homelessness than adults. Our study found 134 youths have been homeless alone before. Surveyed youths also report their average age at first homelessness alone as 15 years old. 57% of them were homeless for less than 1 year, and 43% were homeless for 1 or more years alone. Studies estimate the prevalence of homeless youth in communities runs anywhere from 5 to 7.7%. If we apply this range of prevalence to Greene County population estimates of youth aged 12 to 17, the result is 950 to 1,450 youth ages 12 to 17 homeless alone in Greene County for at least 1 night, within the past 12 months. We asked youths the main reason they were first homeless alone and received 179 responses. This is more than the 134 youth that told us how many times they were homeless alone, and leads us to wonder if the number of youth that have been homeless alone may actually be higher than the 134 that we've reported. Nearly 42% of youth gave multiple responses when asked the main reason they were first homeless alone. When including multiple responses, half said they were kicked out, a third said there were lots of arguments, and a third cited abuse or my home was unsafe. A quarter cited they disagreed with the rules, and a quarter also cited economics, such that my family couldn't support me or I couldn't pay my bills. 57% of surveyed youths, or 259, indicated they have been involved with one of 4 different systems during their lifetimes. The systems are Child Protection Agency, local or county juvenile authorities, state-run youth correctional system, or adult probation and parole. Runaway history among surveyed youth was high at 42% and is 3 times higher than nationwide runaway estimates for all youth of 14%. Of the 181 youths reporting 1 or more runaway episodes, the average number of times they have run away is nearly 3. Of runaway youths, 57% ran away 1 to 2 times, and 43% ran away 3 or more times. Rates of mental illness reported by youths are high at 41% when compared to the Surgeon General's 10% estimate for all children and adolescents. Runaway youths and homeless youths were both diagnosed with mental illness more so than non-runaway and non-homeless youths, and nearly 3 out of 4 reported having received counseling services of some type. However, a fourth of youths, 108, reported self-mutilation, and more than 1 in 6, or 76 youths, considered suicide in the 3 months preceding the survey. When asked if they were currently seeking certain services, there were 154 youths, with 67 of them under the age of 18, who were currently seeking housing during the 5-week survey period. Other top needs reported by a third or more of respondents include education, transportation, clothing, how to get a job, food, health care, and dental care. Middle tier needs reported by 20 to 30% include support keeping a job, life skills training, a caring adult mentor, parenting skills, and legal help. Youths were also asked about needing more or new services. More short-term emergency shelter and transitional housing for youth were noted by 3/4 of respondents, and transitional housing for pregnant and parenting youths, and a one-stop shop or co-located multi-service center to increase service access for youths were noted by 83 and 85% respectively. Higher risk youths related an even greater need for the above-mentioned services. Given the survey results, what can we do? We can aggressively support child abuse and neglect prevention efforts in our community. Child abuse and neglect is often a precursor to youth homelessness. We can begin to better understand homeless youth and view them through lenses of victimization, mental illness, and as logical outcomes of families in distress. We can recognize the window of opportunity we have in working with young people to bridge the gap from a tumultuous childhood and wounded adolescence to healthy young adulthood in order to prevent chronic adult homelessness in the future. We can intervene earlier, at the right time, in the right place, and with the right approach. We can enhance the local services spectrum for homeless youth, including bolstering outreach, emergency shelter, and longer-term youth housing, while paying particular attention to strengthening our homeless youth prevention and early intervention efforts. We would like to invite you to participate in ending youth homelessness in our area. The Homeless Youth Subcommittee meets every month on the second Wednesday at 1 p.m. at the Community Partnership of the Ozarks. The full 2009 High Risk and Homeless Youth Survey Report is available for download at compartnership.org and therariebreed.com.